Welcome back to our Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. As you know, I already started to upload individual theory explanation videos and already uploaded 3 individual complete videos of theories of child psychology with all pediatric dental examples. We completed 3 psychodynamic theories which are about inner mind forces affect how we think and behave, which is basically related to mind. Today we are starting theories of learning, means ways we pick up new information and skills. So stay tuned for all theories of child psychology. First theory of learning is classical conditioning theory by Ivan Pavlov. First, what is the meaning of theories of learning? So theories of learning are frameworks that explain how people acquire new knowledge, skills, behaviors, and attitudes. They help us understand the mental, emotional, and environmental processes involved in learning and guide educators, psychologists, and researchers in designing effective teaching strategies. They describe patterns and principles that govern how learning happens, whether through experience, observation, practice, or reinforcement. Coming to the classical conditioning theory, this theory was first described by Russian psychologist Ivan Pavlov in 1927. He discovered during his studies of reflexes that apparently unassociated stimuli could produce the reflexive behavior. Classical conditioning is a type of learning through association, where a person or animal learns to think two stimuli together so that one begins to trigger a response that was originally caused by others. Here you have to learn about two terminology. First is the reflexes and the second is stimuli. So reflexes means automatic involuntary responses that your body makes in reaction to certain stimuli without you having to think about it. What is the stimuli? So things or events that provoke a response in a living organism, whether physical, emotional, or behavior. So these stimuli is some things, some events that provoke a response, and these reflexes is the actions or responses that body makes which is automatic involuntary to that stimuli. Now there are 5 type of stimuli and responses. First is unconditioned stimuli, unconditioned response, conditioned stimuli, conditioned response, and neutral stimulus. So basically unconditioned response is triggered by the unconditioned stimuli and conditioned response triggered by the conditioned stimuli, and neutral stimulus is neutral, they don't cause any reactions. First is unconditioned stimulus, so something that naturally causes a reaction. Let's understand this by famous Pavlov's bell dog experiment. Imagine a hungry dog who naturally start drooling when he sees or smell food. So the drooling, the salivation is automatic. He doesn't have to learn it. So which is automatic is unconditioned response. And this food is the unconditioned stimulus. So unconditioned stimulus is something that naturally causes a reaction. So food makes a dog salivate. So food is naturally makes a dog salivate. Now unconditioned response, the natural reaction to the unconditioned stimulus. This salivation is the unconditioned response which is triggered by the unconditioned stimuli. Neutral stimulus is something that doesn't cause any reaction at first. Pavlov rang a bell every time he gave the dog food. Now the bell at first meant nothing. It didn't make the dog drool by itself. It was just a neutral stimulus. No salivation, no conditioned response. Now Pavlov rang a bell every time he gave the dog food. So after repeating these over and over, ringing the bell and then giving the food, the dog started salivation. So eventually when the bell along made the dog drool, which is known as the conditioned response, and this time the bell is conditioned stimuli. So you conditioned these by giving with the food, and you train the dog that when the bell rang without giving food, the dog drool. So conditioned stimulus, the neutral stimulus stimulus become a conditioned stimulus after being paired with the unconditioned stimulus repeatedly. Now, how these relate to pediatric dentistry? So, in kids, their brain works in a similar way. For example, a young child is exposed to an initial stimulus like sound of a hand piece, which produce anxiety. This is an unconditioned reflex. When the sound of the hand piece was coupled with the dentist who was neutral stimulus, it again produced an unconditioned reflex of anxiety. Later, when dentist was presented alone, it is also produce a conditioned response of anxiety. So Pavlov's theory shows how kids can learn fear or comfort in the dental clinic based on what they repeatedly experience or associate. Now, what are the key concepts of classical conditioning theory? The first is acquisition. Acquisition means learning something new by association. A child learns to feel scared when seeing a dentist because they had a painful injection before. So the child acquires the fear by connecting the dentist office with the pain. In short, learning to feel something because two things happen together. So it's known as acquisition. Now, generalization, wherein the process of conditioning is evoked by a band of stimuli centered around a specific condition stimuli. So, here the fear spreads to similar things. A child doesn't just fear the dentist but now feels scared when they see any doctor in a white coat, even if they have never met them. So, they generalize their fear from one situation to others that look or feel the same. In short, reacting to things that remind you of the original scary experience is known as generalization. Now, extinction. This means the fear or reaction fades over time if it's not reinforced. So, reinforce means the process of strengthening a behavior by using a stimulus that increase the likelihood of that behavior happening again if it is not reinforced. So reinforcement is the process of strengthening a behavior by using a stimulus that increase the likelihood of that behavior happening again. So if something bad can't repeat it again and again, so it fades over time, and that fear or reaction is known as extinction. If the child has several dental visits without pain, the fear slowly goes away. The body unlearns the condition between the dentist and pain. So, in short, when the fear disappears because nothing bad happens anymore. Then the discrimination. So, discrimination is the ability to tell the difference between the situation. The child starts to realize that a friendly dentist who gives no painful injections isn't the same as the doctor who causes pain. They stop being scared of all clinics and start being okay with some. In short, learning that not everything similar is actually the same. There is a one novel approach or one modification which is recently published in 2025, which is known as Savitha's desensitization technique, a novel pediatric approach. This is for residents and who doing masters in pediatric dentistry for you guys. So the objective of that technique is to reduce dental anxiety in children aged 2 to 7 during their first dental visit using a customized classic condition method. So they customize their own classical conditioning method. So they use the vanilla flavored cartoon sticks instead of standard dental instruments. First pre-appointment, they collected children's favorite cartoons, and during the visit they give them vanilla flavored cartoon sticks, whichever the cartoon they like. Measure the anxiety before and after this intervention by Venham picture test. So the condition strategy here is the cartoon themed dental sticks are the neutral stimulus. Unconditioned stimulus is gentle, non-invasive oral examination, and conditioned response reduce anxiety and increase cooperation. So whenever they give the cartoon themed dental sticks with the combination of non-invasive oral examination, they get the conditioned response of reduced anxiety and increased cooperation. So the result is significant reduction in anxiety scores post desensitization, and children showed better acceptation and cooperation. So the conclusion of this novel approach is the technique effectively uses classical conditioning by pairing pleasant stimuli, which is cartoon sticks and the flavors, with dental procedures teachers promoting positive emotional responses and behavior compliance. So this second number reference is that article of this Savita's approach. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll share you the PDF. New videos on Sunday. We also put image based MCQs in pediatric dentistry in our shorts, and we'll put lots of types of MCQs related to pediatric dentistry. So press the bell icon for every update. Like, share and subscribe. Thank you.